Here we go. So welcome to the Exam One Review. My name is Rebecca. I'm one of the PNR4 instructors. So hopefully you guys can see my screen. If for some reason you're not, please let me know before I get started. So this review, I feel like the PowerPoint and the Exam One review sheet, they work really well together. This first slide here has all of the general terms that are probably, the ones that really are important that you definitely need to know the definitions of. And then if you have the Exam One worksheet, these are the same terms that are on that worksheet. So if you had any questions, you have the PowerPoint now. I know I sent it to my students. I don't know for the Curleen and Karen, do you guys have the PowerPoint also?
I'm in your class. Yeah, I have it.
Yeah. So Karen, do you have the PowerPoint?
Yes, I do.
Okay. So Curleen, I thought you were in my class, but then Karen said she was working with you, and I was like, I don't know, maybe they're in. So do you guys go to the same campus, or how do you know each other?
No, it's me and Jessica.
You and Jessica. Okay, that makes more sense. Okay, so I do want to point out some things that I know are kind of on there that I want to make sure that the cephalcaudal and the proximal distal. So the cephalcaudal is from head to toe and proximal distal midline to periphery. So this is going to be like you have head control before you have trunk control. So it's not just going to be necessarily knowing the definition, but then also being able to say how you would see that in your patient. So what would be an example of proximal distal development? What would you see in your patient that is a demonstration of proximal distal development?
They move their arms before they move their fingers or their toes.
Right. Very good. So they're going to move their trunk and their arms for their fingers, and they're going to move their legs before they move their toes. So the outermost things, having dexterity with your fingers, etc., develops after the center. So that's proximal distal. And then I think maturation is kind of a, it has a very specific definition in this class, in the sense that it's like the way in which you grow and develop as dictated by inheritance, which is different going to be than growth, which is just going to be a change in physical size. So maturation is something that you definitely need to be able to pick out, that maturation is really dictated by inheritance. So when we talk about inheritance, we're talking about, ethnic, Japanese people are going to be smaller than European people, or something like that. So your ethnicity, your personality from your parents is somewhat dictated by inheritance. There's a lot of things that go into what you inherit that is going to develop maturation, whereas growth is just a change in your physical size. So really being able to differentiate between like growth is just getting bigger, and maturation is how you grow and develop. And there's a huge piece of that that's dictated by inheritance. And then having said that, so heredity, which is going to be, your physical characteristics that you inherit, is also going to be a factor that develops maturation. So really putting inheritance and heredity and maturation together, and that's then going to be different from growth, which is just a change in physical size. And then development is just increase in body function. So growth is size, and development is like first you crawl, then you walk, then you run. And then all of these terms here in terms of like extended family, blended family, I think you guys know this, but I'm going to go ahead and ask you, can you give me a definition of like who you would consider to be an alternative family? What type of family unit would that look like?
That could be like your best friend.
Is it like your friends?
Yeah, could be your friends. Yeah.
Oh, the church.
Could you say that again?
Oh, the church.
The church?
The church, yeah, potentially. Like if you live with multiple people from your church, yeah. And to be honest with you, like I don't necessarily think this is in my mind true, but even like same-sex couples, two women raising children together.
I was just going to ask you, are they going to say that that's what that would be? But that's, to me,
I know.
That's a regular family. That's a nuclear
family.
family.
I know. I agree with you. But yeah, nuclear is really the like I call it the leave it to beaver family. Like the mom,
it's the traditional.
Yeah.
What's the traditional term that's been over generations.
Yeah. Yeah. And then the extended family is going to be the multi-generational. Blended is when like parents get divorced and remarry and they have kids from other marriages. And the alternative is going to be really anything. And in that they put same-sex couples. even though in my mind that's really the same as a nuclear family, but when they're talking about it on the test, that's what they were be referring to. And there's a couple of reflexes that we talked about in class. So the extrusion is when you put something in the mouth and they kind of spit it out. And this is like a protective reflex. If you know, when they don't want to eat, when they're not ready to eat, they'll do that. And then the grasp is when you put something in their finger and then they wrap around it. Whereas prehension is they're going to be grabbing something. So the thing about reflexes, like you kind of start with primitive reflexes and then those change and become voluntary things that you do. And a really good example of that is going to be like the grasp is like a reflexive, but then as they get older, they move their hand and they grab things. And the parachute reflex, that's when you flip them over and their arms go out. That's really a protective mechanism to protect their body. And then there's a couple things, negativism, ritualism, and egocentrism. These all go along with the toddler years. So that negativism is saying no all the time. The ritualism is that having that sense of security by having routines. And the egocentrism is, it's all about me, me, me. And then parallel play is one of the first types of play. These are going to be the kids that are like two kids that are near each other, but they're not playing with each other at all. They might each have blocks and they're building two towers separately, or they're on the beach and they're each building something in the sand, but they're not building anything together. So these are all going to be on there and they're all on your worksheet. So I would definitely, if you have the ability, I don't know how you study vocabulary words. Maybe it sounds like Jessica and Carlene, you guys are studying together. So maybe you could ask ask her one of the words and see if she can define it, something like that. I think that if you, if you can do that, if you can, remember it that well, you definitely know the definition. Like if I can just say to Jessica, what's a nuclear family? And boom, she knows, and she really knows what that word is. So if you guys can kind of practice back and forth with each other with those words, then, I think that'll help you on the test. So now we're going to go over a couple. I know that Jessica said she thought we talked on Freud, Piaget, and Erikson quite a bit. So we're going to do that again. So Freud is the psychosexual, and I think that the names of his stages make sense. So oral, that's the infancy. They put everything in their mouth, and they take pleasure from oral activities. And this is kind of important when you're dealing with like kids in the hospital. They really like a pacifier, and having a pacifier helps them calm down. It can even help with their pain sensation. And then the anal stage is the 2 to 3 year old, and just whatever stage you're talking about. Toddlers are potty training. That's kind of like the main developmental thing that they do in that age group. And so potty training and anal, that's the anal stage. And then the phallic stage is that stage when they're kind of learning about gender, and boys are really attracted to their mother and girls tend to be really attached to their father, not attracted, attached. See, this is kind of when you get like the mama's boy, daddy's girl sort of relationship. And then after that, when they're kind of more school age, that's the latency phase. And this is, they're not really interested in sex. Like they kind of go through this period of time where they want to hang out with their own gender and they're not really thinking about sex too much. And then, puberty, the genital stage, this is when they really start to develop physical attractions. Freud always talks about the opposite sex, but, I think we've said several times in class, we all know that there are gay people among us, and so kind of just adjust your theory based on how we view the world now. When Freud was around, being gay was wrong, so all of the theorists kind of talk about opposite sex partners. But I would definitely kind of recognize these stages and be able to pick out, like if someone said to you, the stage of Freud's development where boys are more attached to the mother is what, then you should be able to pick out that that's the phallic stage. It wouldn't be surprising if they gave you a description of a stage and asked you to choose which stage that is. So this is kind of
all these multiple choice. These are all multiple choice within.
They're all multiple choice. Yeah.
Fill it in. Okay.
No, the only thing that's going to be a fill in the blank is the math.
Well, yeah, that part I get. It's just I literally am one of those. I couldn't just give me a few to look at and then I can pick it out. I can't just off the top of my head.
Okay. Yeah. That's fine. So I think we talked about this. So Freud's stage of orality, they explore the world with their mouth. Can you give some examples? This is like, if you've ever been around a baby, they're just constantly putting things in their mouth and they're tasting things. And then the anal stage, that's the toddler stage, exercising power by saying no. The phallic stage, becoming aware of sexual being. This is when they start to, like, boys attached to their mother, girls attached to their father. And then latency, that's when they're into their same sex peer groups. So I think I told my students in class that Piaget really based his theory on Freud. So they have a lot of similarities. So when you start, for Freud, it's oral, and then Piaget is sensory motor. So just kind of think about an infant, they're exploring the world with their senses and they're starting to move. So that's sensory motor. And then the kind of the preschool years is the pre-operational. For me, there's a huge, there's a lot that happens in 2 to 7. So it starts out with like very simple language development. And by the end of the pre-operational phase, they're speaking in complete sentences and they're telling stories. So for me, there's just a lot that happens in that 2 to 7. And the thing that I think you need to pay the most attention to is that it's a lot of language development. And this is that stage where they're very imaginative. This is where they're going to have an imaginary friend, or they're going to, sometimes they say things like, God's crying and that's why it's raining. They don't really have that, concept of like weather, or, they just haven't developed well enough cognitively to really understand how those things work. But then when you get to the concrete operations, then they're really logical. And this is where they really start to understand cause and effect. And they start to get really good at math, or better at math. And then the formal operations is that adolescent period where they can think theoretically and hypothetically. They develop that abstract thinking. So this is going to kind of be the same thing, where they might, describe a kid that is really concrete and logical in their thinking and ask you to say, well, is that a school age child or an adolescent or whatever? So being able to recognize when you see a description of the stage, being able to figure out what age group that would be. And vice versa, if they give you the age group, being able to be like, oh, well, this is where they're starting to get better at math. So some things with concrete operational, this is like, like a pre-operational kid. If you have a glass of water and one's really tall and thin and one's fat, they don't understand why the water level is different if it's the same amount of water. They don't have that concept of like volume. But once they start getting into like the school age years, this is when they're going to understand like the shape of the glass determines how high the water level is going to be. They just start to be able to have those more complex thoughts, but it's not like hypothetical or abstract. That's going to be the formal operation stage. So this is gonna, this is some more information about Piaget. So sensory motor, we talked about, they're sensing the world and they're moving around. And the pre-operational, they're a lot of language, a lot of imagination. Concrete operations, this is when they're starting to get into that cause and effect. Why do pigs fly? Why do I get sick? This is the why stage. And then formal operations is that hypothetical. They have that more mature, able to like, think about what would happen and come up with various scenarios that for a if would sort of situation. And then Erickson, I think Erickson is probably the most tested. Like you're going to see Erickson, I think, on all 3 exams. And the thing with Erickson, this is the only one where there's 2 things that oppose each other for every stage. So infants is trust versus mistrust. So if they are getting the care that they need, then they develop trust and they feel like the world is a good place and they can trust the world. Where the toddler, autonomy versus shame and doubt. So they either develop a sense of autonomy or they develop shame and doubt. So for every stage, there's 2 opposing forces and you want them to develop trust. You want them to develop autonomy. You want them to develop a sense of initiative. So your parenting and your educational techniques are kind of geared toward them having a positive resolution of that stage. So, Erickson goes through adulthood. So we stop at the adolescent identity versus role confusion. So, the I think that we talked about in my class, I think we talked about it quite a bit. So I would definitely, it's sort of the same thing. Unfortunately, there will be questions on there that, you're going to have to be able to differentiate 3 to 5 initiative versus guilt and 5 to 13 industry versus inferiority. So you want them to develop a sense of initiative in the preschool years, and in the school age years, you want them to develop a sense of industry. So just kind of being able to make those subtle difference, recognize the subtle differences between the stages. So this is kind of reiterating that point. So like certain things that toddlers do to develop that sense of independence, they're learning to potty train, they're learning to feed themselves, getting dressed by themselves, etc. So doing those things helps them develop that sense of autonomy. So whereas the school age, this is the industry versus inferiority, this is developing skills and teamwork. So this is like being exposed to things that they can be good at. Like, you don't want to ask a 8-year-old to paint something that's going to be really realistic because they might not have those skills, but they can be in an art class where they start learning how to draw. And if they do things and they're good at it, then they're more likely to develop a sense of industry. Whereas if they are exposed to things that they're not really ready for and they're not good at, then they're going to develop that sense of inferiority. So you want them exposed to things and you want them to do things, but you also want to target what they're exposed to things that they're able to be well at. So they develop that sense of industry. And then for Maslow, I think you guys have had Maslow before. The one thing that I can say is that it's important to recognize, what the different stages are. So the bottom is going to be your physiological needs. This is, do you have food? Do you have water? And then the next one up is safety. Do you have a place to live? Are you dry? Do you have heat? And the next one is love and belonging. And then you have your self-esteem and your self-actualization. So it's just sort of, you do need to know like the different names. You need to be able to say the bottom is physiological, the second is safety. And then if they throw a hierarchy in there that's not on here, that's not the right answer. So they do want you to be able to recognize what each level of this triangle is called and that they build on each other. So Kohlberg, and I appreciate Jessica mentioned to me that she didn't think that we had really talked about it, so we'll talk about it now. So Kohlberg is the moral development. So, the first stage is kind of infancy through preschool. And then it's really just kind of avoiding punishment. Like you told a kid no and they get punished, and then they don't do that because they don't want to get in trouble. So that's kind of guiding their decision making. And then as they enter the school age, they're a little bit more focused on how am I viewed by other people? I want to be a good kid, or I want to be perceived as being good. And just like in Piaget, we're in that concrete operations where they're very logical, they're also very fixed on the rules. Like you are supposed to follow the rules. They're very much in that concrete thought process. And then as they moved into teens and adulthood, this is when they start developing a sense of like, is it ethical? Is it right? Or is it wrong? Before they get to the teenage years, they're not really thinking about like ethics or morals. Their decision-making process is less mature. And the thing that I think that is the most difficult, and I know I mentioned this in my class, is that your fear of getting in trouble never goes away necessarily. On some level, it stays with you. So even if you as a school-age child are thinking about how I'm going to be perceived by my friends, which you're not thinking about that when you're a toddler, you are also probably still making decisions based on the fact that you don't want to get in trouble. So they build on each other, but just because you become a school age child doesn't mean that you stop making decisions based on your fear of getting in trouble. Like that just kind of is part of your thought process when you're making a decision. So there's certain things, we went adolescent, we did infants, toddlers, preschool, school age, adolescents. So there's certain things that, you should be able to pick out about each age group. So one of the things, kind of recognize is that neonate is what we use from birth to 4 weeks. So after they're a month old, then we start referring to them as an infant. So just to be able to pick that out, if you ever ask a question about a neonate, you're talking about a baby that's 4 weeks old or less. And you do need to be able to remember some of these key height and weight things. So like the infant's weight doubles by 6 months, it triples by 1 year, and then it quadruples by 2.5 years. So just kind of like if they give you a birth weight, being able to figure out what you predict it will be at 6 months, 1 year, etc. And then the average height increases by 1 month for the first 6 months, and then most kids are around 29 inches by the end of their first year. So what are some things that you think a 1-year-old should be able to do? Like some things that if they're not doing, you would be like, that's a problem. There's something that we need to intervene on.
They should be able to sit.
Talking,
Yeah.
maybe like speaking or like some type of like, they should be at least saying something, some form of
Okay. Some form of communication, and also like standing and taking their first steps, right? So if you have a 1-year-old that's not saying anything and not standing and taking a few steps, then you have a 1-year-old that's delayed. So it doesn't necessarily mean that there's mental retardation. You need to figure out what's going on though. So you definitely need to be able to, pinpoint like at certain points, if they're not doing something, they're not meeting their milestone, and you would need to intervene. So the big one for a year is definitely they should be standing and they should be taking their first steps. In terms of feeding, the first 6 months should be breast milk or formula. We encourage breast milk, but never like judge someone that's giving formula. And then what's the first food that we start with?
Cereal.
Rice cereal. And it has a very low allergy profile. And then how often do we introduce new foods? How many days apart?
4 to
4 to
7.
7.
4 to 7. Yeah. And then at what age do we think kids should be feeding themselves by them? Like you could give them food and they can feed themselves.
Like fully, like with their spoon and everything, or they're just in there making a mess, but they're feeding themselves.
More like maybe one of those plastic spoons, not like necessarily the metal ones that you eat, but they can literally feed themselves, not just make a mess.
So like 18 months.
Yeah, so we would say
15
definitely
months.
by 2 years. So just kind of remember, by the time they're 2,
Okay.
so before that, they're probably more making a mess. So this is some more information about the infant. Some of it's repeated, talking about like Erickson, developing the sense of trust. So this was mentioned in class, and I know it's probably going to be on your test. This phrase, lethargic infant. Do you guys remember what we talked about? What did we talk about in terms of what a lethargic infant is and how you intervene?
That's that tummy time, the head thing, isn't it? Where they're not able to lift their head and stuff.
So that's a head lag. So you definitely want to do tummy time. So lethargic infant is a phrase that they refer to as a baby that's overstimulated, and then the baby kind of shuts down and they don't want to interact. So when you're presented with that phase, think about a baby that's overstimulated and what you would do to help that baby. Because if they're so shut down, so overstimulated, they're not reacting, that's a problem. So you're going to avoid bright light. You're going to move them slowly, speak to them gently, calm voice. And you also want to reposition them. You don't want to like just leave them flat and not exposed to any stimulation, but like expose them to stimulation slowly and gently. So, having them sit upright at intervals and having them lay down, but not have them be in an environment that's like full of bright lights and loud noises, etc. So this phrase, lethargic infant, it kind of refers to an infant that's overstimulated and doesn't want to interact with their environment.
Could that also be towards a baby that's been born, those babies that are born addicted as well, that are they're overstimulated, so you have to make sure to keep things very copacetic, very calm, don't touch them too much.
Right. Yeah, it's the same sort of concept. Yes.
Okay.
And I think the thing that sometimes students forget when they're asked like, how would you respond to this infant, is lifting and sitting them upright at intervals. They still need to be repositioned occasionally, but you just need to do it, at intervals and calmly without a lot of noise, etc. You can't just like leave them on their back all day. So in terms of, child checks, this is something that's really important throughout childhood, particularly in the first couple of years when they're still getting all of their immunizations. You also do their height, weight, and their head circumference, talk about their diet, how they're developing. SIDS, we talked about SIDS. What's the main thing that you do to prevent SIDS in kids? Education point.
Don't put things in the crib.
They
Don't
need
put
to
things
sleep
in there.
on. They
Yeah.
need
Not
to
to
sleep
sleep
on
on
their
their backs.
backs.
Yeah, so this is the back to sleep. And then automobile safety, we do need to know about car seats. So they should be in a rear facing car seat up to 1 year or less than 22 pounds. Should be in the center of the rear seat, and you should anchor it with a seatbelt. And then the sling carrier, does anyone know what these are? These are like the carriers that sometimes you see the moms, they put the baby in. So you just need to make sure that the baby's able to breathe, that they're not like so squished in there that they're getting suffocated. So this is something that's definitely need to remember. There's a lot of, emphasis out there about being healthy and being low fat. So you do need normal quantity of fat in your diet for brain development. So certainly not any low fat diets for kids under the age of 2. We talked about birth weight doubling by 1 year, tripling, or doubling by 6 months, tripling by 1 year, and then this quadrupled by age 2.5. So they're starting to be able to eat on a more schedule with the rest of the family. Their stomach's getting bigger. They do a lot of language development. This is their stage where they really develop that sense of autonomy. The main thing is potty training. And then kind of getting into like negativism, temper tantrums, and timeout. So what do you guys remember? How many minutes do you put a kid in timeout for? How do you figure out like the normal timeout that you should give for your
A minute per age.
Isn't it a
minute per
minute per age?
a minute per age? And then what do you do when they have a temper tantrum? What's it like? What do you do in the moment? They're screaming and they're throwing a fit. What do you do? Carlene, what did you say?
I said ignore them.
You kind of ignore it. Like you don't give in. Like, yeah, you're right. Just let them scream. Like, yeah, if it's, you don't want to do a lot of negative, like any sort of reaction is a reinforcement of the behavior. So, if they think they're going to get picked up and taken into the other room, if they scream, then they're going to just keep screaming. Right. So just let them have their moment. And it can be really embarrassing. You can be like in Target or something like that, and they're throwing a fit and you're embarrassed. But the best thing to do is just let them have a temper tantrum. And then you can put them in timeout for 2 minutes and be like, we don't do this. But in the moment, you just let them have their fit.
Cry with them. Have a fit with them. They look at you like you're crazy.
So then we're preschool, and we talked about like, if at all possible, kids should be going to preschool. They learn a lot. This is when they really start to develop that sense of initiative. And this is Erickson's theory for Colbert. They're kind of aware of others. They're not as egocentric as the toddler. There's a lot of language development. This is where they start moving towards more mature, types of play. Like when they're younger, they're just playing near each other, where now they're going to be doing a little bit more cooperation, starting to play games. Sometimes parents are worried about thumb sucking and masturbation. So what can you guys tell me about thumb sucking and masturbation? Are these things that parents should really be worried about?
No, because it is.
Maybe not thumb sucking. I used to suck my thumb for a long time. I would
Yeah.
say the only thing is that with kids that suck their thumb, it's kind of like a coping mechanism. So they usually do it for like comfort or something like that. I feel like the only thing that parents do worry about is their teeth and how their teeth come in. Right.
So if most kids stop by the time they start school. So in the preschool years, if they're sucking their thumb for comfort, it's fine. You don't want to really make a big deal out of it. You do start to worry if they're school age and they're starting to get their adult teeth in, which usually happens around age 6. So generally speaking, you want to like reinforce positive behavior. So if they don't suck their thumb, you can give them positive reinforcement, but you don't want to do anything like put anything like hot sauce on there or really punish them or anything like that. And then how about masturbation? Is this something that kids do?
Yes,
Yeah.
it is.
Yeah. Right. So it's something you can talk about. This is something that you do in private. We don't like, go to IHOP and masturbate or whatever. But the kids will do it. And so parents need to be aware that this is normal. They're just exploring their body. And then do you guys remember the difference between primary enuresis and secondary enuresis?
Isn't secondary where it's like they they've been dry, but now they're starting it all over again. Whereas the beginning is like it's normal, it's gonna happen and they grow out of it.
Yeah. So secondary enuresis is going to be bedwetting for a child that has been dry for a year. So, and then when we talked about in class, like sometimes kids just like stress. There's a thunderstorm and they're scared and they pee their bed. But sometimes there's like a medical problem. So, it could be diabetes, or it could be like, you know, well, diabetes is kind of the main one that I think of, but there could be like a physiological medical problem that's causing them to wet their bed. So just kind of being paying attention, like certainly you're going to be a little bit more concerned if it's like they've been dry and then they start peeing again after a year of being dry. You're going to have to like think some more about what could be going on. And then the school age, this is, they're moving from active play probably into more like sports, organized teams, et cetera. They're going to have like more cooperation. This is when you really want them to develop that sense of industry. And this is their latency phase where they're kind of girls hang out with girls and boys hang out with boys. Generally speaking, the growth kind of slows down and then they'll shoot up again in puberty. So they tend to be a little bit squattier. And then when they hit puberty, they grow taller. And then for the school age child, this is going to be your concrete operations for Paget. These are things like if you have a kid that's not doing well in school, you're going to still be doing like vision and hearing screenings. So that could be something that's causing them to not do well in school. And then it has the question, how would you address a child who is struggling with focus and attention? So what sorts of things would you suggest to parents if they're not being able to pay attention in school?
Repetition, but I would also have them, I mean, it's sad to say, but you would go and have them checked. Like you want to see if they are ADD, ADHD, but repetition.
Yeah. So there's a couple of things, like you have to have ADD on your horizon to be thinking about it, but then also making sure like, is everything okay at home? Do they have food? Are they getting enough sleep? Or is there stress at home? They have a vision problem. Do they have a hearing problem? And then once you kind of rule out all those things, you need to think about, do they have ADD and do they potentially need treatment? So then the adolescence, this is when you release hormones, you start having physical attraction. And Erickson, this is going to be really, really develop that sense of identity. So this is really going to be like their peer group is really, really important. And what their peers are doing is what they're going to do. And then how do you talk about difficult subjects with adolescents in terms of like sex and drugs? Like how do you start that conversation with an adolescent? What are some techniques that you use?
I mean, could you say something as far as you have a new boyfriend, tell me all about him? Like kind of keep it like an open-ended, don't be so direct.
Yeah, so open-ended is very good. Also, you don't want to share your personal story, but sort of build a rapport. How are things going in school? Do you like your classes? What do you like about your classes? Okay, and then you start kind of moving into more personal, but always keeping it open-ended. So like start to have a conversation with them, be open-ended, and also be non-judgmental. So it says on here, the last point on here is what's the number one hazard and kills many adolescents. I know in your textbook, I'm just going to point this out. It says motor vehicle accidents. So if you're ever asked on an exam, accidents, motor vehicle accidents is the leading cause of death. I know there's a lot of statistics out there about gun violence being like the leading cause of death in certain age groups, but that's not the right answer on your test. So the right answer on your test is the motor vehicle accidents. So certain things to think about, you know, as a nurse, you guys have talked about the nursing process in other classes. So being able to kind of identify what you're doing as a nurse in each one of those stages. So, you know, when you're in the planning stage, you're making up, you know, what you're going to do. And then the implementation stage is you're going to be teaching, for example. And then the evaluation stage, you're going to be evaluating whether your teaching was effective. And then once you get to the end, you're going to go back and start the nursing process all over again. We talked about the Denver 2. So what can you guys tell me about the Denver 2? Who remembers what the Denver 2 is?
Somebody else has to answer, man. I don't want to be the only one that keeps answering.
No, how about Curleen? Do you remember the Denver 2, Curleen?
Yeah, it's not for intelligence. It's just to see their growth at their current age, to see if they're developing correctly.
Right. So, and there's 4 different areas that they look at. And that's the main thing. It's something you can do in the pediatrician's office. A lot of times the nurse can do it. So it's not diagnostic of anything. So like if you do the Denver 2 and they don't have the language ability that you would expect in a 3-year-old, doesn't mean that there's a problem. It means that you need to figure out why they're not having the language development that you would expect in a 3-year-old. So it's kind of a screening tool. It's going to screen more kids in that have actual problems, but then you're going to get them to the available resources that they might need to help with their language skills or help with their physical skills, etc. So sometimes parents are nervous because they think it's an intelligence test, but it's not an intelligence test. It's going to look at a wide range of skills and milestones at different age groups. And then depending on how they do, you might then refer them to like physical therapy, or you might check their hearing or check their vision. You might follow up to see if there's like something going on that's causing them to score lower on the Denver 2. We talked about times outs and then body surface area. You guys do need to remember that this is the most accurate way for calculating medications in kids. You're not going to be tested. You're not going to be given a math problem where you have to calculate the body surface area, but you need to remember that the BSA, or the body surface area, is considered the most accurate for calculating medication dosages. And then just about medications, also remembering kids are at higher risk for toxicity because they have the immature kidneys, immature liver. So we pay more attention to dosing. Is always going to be either body surface area or milligrams per kilo to make sure that they're not going to get a toxic dose of the medication. And sex education in adolescence, we kind of talked about like open-ended questions, non-judgmental, having a rapport with them before you really delve in. So this is going to kind of go over more information about the medications. They're more at risk for toxicity. And this is wrong here. This is, oh, wait a second. This is right. I'm sorry. Vastus lateralis. So for children under like age 10 and toddlers, this is the vastus lateralis, which is the thigh muscle. That's where you give the immunizations. But then when they get to the teenage years, you're going to do the deltoid, which is up here.
So that's not that ventral gluteal, because that's the booty, isn't it?
Yeah, it used to say that it's not. So the ventrogluteal would be like medications where there's a bigger volume because it's a bigger muscle. So if they needed a bigger volume of medication, so like Depo-Provera, which is like a birth control shot that some teenagers get, you'll give that in the gluteal because it's a higher volume. But like immunizations, the most of the shots they're going to give, you just give in the deltoid.
Thank you.
Yeah. And then, you know, we talked about, you know, if you have a kid that has an IV, you need to be assessing it every hour, looking for signs of IV infiltration, etc. You do need to know how to program a pump. So pumps are programmed in milliliters per hour. So you might be asked questions like, if you have to give your patient 400 milliliters, how many milliliters per hour will you program the pump? You need to know both of those things. You know, pacifier, this is getting back to like, the oral stage of development, they get a lot of comfort from the pacifier. So sucking on a pacifier helps them calm down. So even if they're like NPO because they're going to have surgery or something like that, they still need to have access to a pacifier to help calm them down. And this is something that I don't think we talked about, but you do need to know. So a lot of times kids are in the hospital in diapers and you need to calculate their urine output. So you just subtract the dry weight of the diaper. So if a diaper weighs 20 grams when it's dry, and then you weigh the diaper and it weighed 80 grams, how much did they pee?
60.
60. And 1 gram equals 1 ml. So you're going to just subtract the weight of the dry wiper from the wet wiper of the wet diaper. You subtract the weight of the dry diaper from the wet diaper, and then whatever number of grams that is the number of milliliters that they peed. And then the other thing that we talked about, if you have to get a urine culture on a baby, how do you do it? How do you get the urine? You have to do a straight calf.
Okay.
Straight calf. Okay. And I think we talked about you need to make sure that you know how to do your dosage calculations. You need to first, they're always going to give you the weight in pounds. You have to figure out how many kilograms that is. So divide the weight by 2.2. And you need to, they give you like the available amount and you have to figure out how much you're going to give based on the order. I think my class gets it. I've talked to a couple people, but if you don't, let me know. But the example would be like somebody is 60 pounds and their dose is 5 milligrams per kilo and you have available 500 milligrams per 5 mLs. You're going to have to figure out their weight in kilos, figure out how many milligrams they're going to get per kilo, and then figure out how many milliliters that is based on what you have available. So there'll be math questions that have several different steps that you have to go through. And then we did not talk about this in class, but you do need to know it. Does anyone know why you avoid tetracyclines, which is a type of antibiotic, in the first 8 years of life?
I was looking it up right now and I don't even.
I know with pregnant people it causes delay
They
in the
cause-
child.
It does. Yeah, you're right. For pregnancy people, it causes permanent staining of the teeth. So even if they don't have their adult teeth in, they can cause like their teeth that haven't come out yet to be discolored.
Oh.
But you're right. Also, for the pregnant women, it can cause birth defects. So you can't take it when you're pregnant. And then who remembers what a latchkey child is and what does that mean?
They're just at risk for being hurt more often because
they're stay at home by themselves.
Yeah.
Yeah. So these are kids that come home from school and there's no adult in the house. So this can kind of be a tricky question. So like if you're asked, what education point should you give to a mother about latchkey children? Like giving the mom the definition really isn't that helpful. You need to tell the mom what they're at risk for. They're at risk for accidents or et cetera. So, some teaching points is, they shouldn't be opening the door for strangers. Maybe you should talk to the neighbors so that they have like an adult that they can go to if they need any help. Other kids shouldn't be coming over. They shouldn't be cooking if they, when they're 8, because they want them to burn themselves, etc. So latchkey in general is just like the kid that's they have a key to their house and they're going to let themselves in and there's no adult to take care of them when they get home. And then thinking about what sorts of education you would give to a mom or dad if that's their situation. So that's it. Those are the main points. Do you guys have any questions?
The quick fact though, what is the leading cause of death in children?
Yeah, it's the same thing. It's going to be accidents.
Accidents. I was going to say, do we break it down or okay?
No.
Okay. All right. Okay.
All righty. So for me, if you guys have any questions, you can send me a message and then it'll take me a while to upload this in the YouTube, but I'll post in the same announcement that has the other instructors' videos. I'll post this in our announcement section. So
Thank you, Professor.
you're welcome, you guys. Good luck. I'll see you guys next week. Bye, Karen.
Bye.
Thank
Thank you.
you.